Hello.
Hey everyone.
My name is Dr. Strohman, a lifescape physician. This is my wife, Lisa Strohman.
Dr. Lisa Strohman.
Dr. Lisa Strohman. We'll just wait a couple minutes, make sure everything's working. How do we know the microphone's working?
Can everybody hear us? Anybody having issues? Just write us in. I will be on with my husband for the first time. So he's going to lead the Q&A and we're going to look through them. I don't have my glasses on, but we'll be helping him. Let us know. I know that we're going to start off. You were going to start off talking about...
Yeah, there's a couple questions
that were already submitted.
I just wanted to make sure the video was live and the volume was working.
Yes, got it. David, thank you, Gary. Working. Thank you for telling us. Yes.
Okay. So I was going to start off with just some basics. So we're here for the COVID-19. I just wanted to make sure everything's clear. We have 650,000 cases in the U.S. 32,000 people have died. There is tending to be a flattening of the curve, especially in New York. Interestingly, flattening of the curve or the peak in Arizona likely will be later, probably May 1st. There's been some new phases that the government has implicated or started as far as getting us back to a new normal. Vaccines still, we're hopeful, but again, it's probably quite a ways off, probably springtime. There's quite a few questions on medications, and there's a few. The biggest one that has gotten most of the press is hydroxychloroquine. It's used for malaria and autoimmune diseases, and basically blocks the virus from getting into the cell. There's still large studies. Actually, one study was halted due to some cardiac arrhythmias. So like with any medicine, you can get side effects. So that one is probably ways off. There's been some newer ones with remdesivir, which is used in which is used in Ebola. It works in vitro, but those studies are pending. The best one probably to date is the passive immunization, where they give blood from someone who's IgG positive. So far, that's the safest of the option, and they've used that. And there's some newer ones that are blocking the cytokine response, which is when people get severely ill, day 10 to 14, they basically get this cytokine storm. And there's a couple medicines we use for psoriasis and rheumatoid that actually could help block that response, which would hopefully prevent people from going on the ventilator. So that's a basic update.
So from this, can I jump into the psychology?
Yeah.
Okay. So the psychology, I just got off another webinar. The psychology of all of that is, I think, living with a top doctor for many years and being in it, I think that the psychology of what I see is like people are fearing the unknown, and this is a brand new virus that they're trying different treatments with. And so the psychological part about it that I think that you're trying to look at from a medical standpoint is that doctors don't like to guess when people's lives are on the line. And so, which is great for us because we know that we have really good doctors on point. The good news is they're working on vaccines. We're finding out things that are working with some people and not others, and they're differentiating why that is. And then the how and the when and the whys will be answered. And that you have to feel like it's normal to be anxious, a little bit concerned about it. But those are some of the things that I think when I'm talking to people in the psychology standpoint of it, that I'm dealing with on my end.
And there's no certainties in medicine. All these medications, even the one that's being studied now, the hydroxychloroquine, I'm sure there's a percentage of people that are going to get better, a percentage of people who are going to have side effects, a percentage of people. So it's not going to be like this panacea that's going to cure all COVID-19 disease. So, and that's where we come into trying to weigh risk. What's the risk of doing an antibody test? What's the risk of putting you on a medication for this? We do this all the time, even with bronchitis and pneumonias. What's the risk of putting this person on simply azithromycin to treat a pneumonia? But there's risks of the medication. So all this is weighing risks.
So one of the questions that jumping in on that part, I feel like little balance between doom and gloom and optimism of like what the good is. But I think that one of the things that the questions were, if somebody is having somebody wrote in about brain fog, there's a ton of people that are struggling right now with stress. We're not sleeping the same. Our schedules are off. Again, like the
Really?
doctors.
Their schedules are off?
Yeah. I think I was up till 1 last night. But I think that, in the doctor in the house, like, we need to be eating right. We need to be sleeping, no alcohol, like all of those things. Yes, that is my world. But again, like best practices, but that brain fog is oftentimes the two primary things are stress and lack of sleep. So again, like, we should feel a little bit out of sorts right now. That's totally normal. When you're getting to your point where if you're not remembering where you're going, or you're having like true cognitive impact from this, then it's time to call the doctor right in, like basically, and let them know that you're fundamentally seeing different changes and you're not functioning properly.
Like we do televisits. So, I mean, that's the opportune time to, diagnose it over a 45-minute visit and figure out, do you need to see Lisa? Do we need to look for other reasons? I know we still are doing blood work. We're still seeing patients. Obviously, we're trying to limit exposure for everyone. So we're trying to triage those things. Yeah.
I don't know if I'm seeing the current notes that are coming in. I know that I had a friend I know that Judy is online. I see your note on my text message, but I don't see you on our strand. So if you have a note, I think that you're writing in, make sure that you ask us, because that's why we're here. Yeah. We could talk a little bit about, so Dr. Amen's clinic, and I did a talk with him, and he was talking about, again, the big three, and what are the big three that we're doing. The big three are sleep, diet, and exercise that everybody should be doing. Hopefully you're taking an opportunity to go over what you can, and like take those spare moments and manage your time with, cleaning out closets or going on walks, and, things that you can do when you're in this quarantine period, I think are really important from a psychology standpoint. But I also think that, having fun, so I call it the PDF, there's play, there's downtime, and then there's family time. That play is like, just be unstructured, be silly, just let go. Out of anything, we need that balance right now because people are super stressed.
Yeah, I've gone on so many bike rides the past week. Yes. It's such a time that you can actually connect with your kids, or
running away from me. Yeah. Yeah, but it really is like that, and that downtime is like, and Bill's really gotten into meditation and taking that time, but that downtime is really when your brain kind of focuses. So again, if you're struggling with some stress and things like that, taking some downtime, go enjoy the sunset, go sit outside. Like, we live in a beautiful state. Take advantage of our weather right now. Even
if it's just 10 minutes, 15 minutes. I've noticed that I was trying to figure out, okay, what was different about the pre-pandemic versus being in the pandemic. And there are certain things that I truly miss. And those things are like, I really want to get back to. I like to play hockey. I like to work out twice a week at a gym. And there's other things that I don't really miss. And those things I probably won't go back and do. So I think it's a good time to just take a pause, reassess what you enjoy about life and what you don't enjoy about life, and make this probably a moment of change in yourself.
Yeah. Let's see. There. Now we've got the comments. Let's see if we've missed any. Recommendations for parents and grandparents from my good friend, Dr. Hansen. Foster parents.
I'd like to know this.
Okay. Hit a chord, Dr. Hansen. Okay. Parents, grandparents, foster parents to recharge after spending 24/7, helping with schoolwork, entertaining them daily chores while adults are still trying to work how to stay healthy and positive. I just got off of a 2-hour meeting with 17 school districts, the governor's office, and the Board of Education. And I will tell you that I think everybody is feeling that way. And if you don't appreciate your education team before now, you should definitely...
They all need a raise.
Bigger gift baskets, bigger appreciations for them. I think that really, this is a really great time to take an opportunity to again, the littler kids are harder, but developmentally, can you give them some time? We're trying to teach them how to self-regulate. When their brains are so young and they're developing, I would say up until about 9 or 10, it's a little bit harder, but getting them a puzzle, doing things that they can do self-directed time to give yourself a break. If you have a spouse or you have somebody else that's sharing those responsibilities, let them go out on a bike ride, walks, like taking moments to downtime on yourself. But again, with those older kids, I think it's really important right now to identify boundaries. One of the things that we talked about was engagement, tone with the educator group, and self-care, putting your oxygen mask on first, so important. But I think that the one word that I think that what I saw missing was boundaries. How do you create healthy boundaries so that they're taking time for themselves and you're taking time for yourself?
And the first 3 days of our pandemic, it was craziness. We tried to say, okay, do these chores, do these studies, and they had no schedule, and it was chaotic. And now we have it divided into hour segments. Do this for 45 minutes. If you finish, then try something else. And breaking the day up, I think that's what they do in school, right? They break the day up in 45-minute increments. That has helped a lot.
Right. And the positivity, I think, that my friend, like Dr. Hans is talking about, is stay positive in yourself in terms of really getting yourself to remind you that you're doing your best. So some days you're going to be super awesome.
And your best is your best is
varies.
Different.
Yeah, it does vary. And
I think good days and I have bad days, so.
Yeah, and he's fun dad. So, they want to play basketball and they want to go do all of these things and things like that, which actually affords me a little bit more time on my end, and he is having fun, but it's demanded time. And so how do I make sure that he has time to regroup and manage himself? And that goes back to tag teaming, being able to talk about it.
Fortunate enough to be able to tag
Absolutely.
team. Yeah, we could be I'm grateful for that.
Yeah. Yeah. My good friend in New York that's in an apartment on a high level with 2 little kids that are under the age of 12. Again, be mindful of what you can take advantage of at these times. This is a great question.
Any other questions? I have a couple.
Let's see. Watch the videos on the big screen. Oh, these are ads I'm reading off now.
I had a question about when will we stop physical distancing? Even when governments lift the shelter in place, should people continue to practice physical distancing? Well, with the government, they obviously think it should be scaled out, and if you meet certain criterion, and if the case incidence goes down, then you can go to phase 2 and phase 3. So I think obviously we couldn't flip a switch and go back to normal life, although I would love to. It's going to be scaled. And I think the antibody testing, the IgG testing, although you look at the media now and they're basically questioning it. And, this goes into IgG testing, IgM testing. Antibody testing, we've done forever. I test mono patients. We test herpes patients. We use antibody testing for valley fever, even viral pneumonias we can use. So these tests have been around forever, and now we're using them for COVID, which I think will help. There's been questions about Vibrant, the company that we've used to test antibodies. This is a full-scale lab. They do all blood testing. They've done tons of antibody testing before, and we've used them before. They also, in their antibody tests, don't just check one protein. They check 4 proteins. And then they check those 4 proteins for, is there an immediate reaction? Is there a delayed reaction? Is there a gut reaction? And that can be very helpful as far as figuring out, did the person get exposed to it? Is a person sort of midstream? Are they at the end? Sorry, hands. And Vibrant is a CLIA CAP certified. They're accredited by the Medicare. So, we looked at the data. We actually got the study sheet that they submitted to the FDA. And their overall sensitivity is 97% and specificity is 98%, which is great. And then you have to combine that data with the prevalence of disease, which we don't really know at the moment. We don't know how prevalent it is, although my suspicion is it's at least 10%, maybe more of the population that's been exposed to it. And we've been seeing a lot of patients that have been testing IgM positive, meaning they've been exposed to it. It's a hard time figuring out what the timeline is. And so anyway.
I would take it into an analogy of it is literally like building an airplane while you're in the air, grabbing the parts as you go. And I think that if you look at and again, I'm no medical doctor, so I can only, and I don't know, he got all the results of the proteins and created an Excel sheet and was very excited about like creating trying to make sense out of everything that's coming out. Yes, he loves his Excel sheets. But what I will tell you is that, if you think about it from a standpoint, like Bill Gates is creating and working with a lab for a swab test that can go direct to consumers. But doing, again, like he's hiring a lab to do that. Vibrant's doing it. So, like, are there situations right now where we've got labs that are creating things as a potential solution, and then the data will come in, and then it'll kind of fall into place on whether or not it was the right testing at the right time. And I again, like the FDA is like trying to accelerate this and give this out. And I think it's really important. I had an international member on the webinar I did this morning. The information that they were getting from their country of origin, which is over in Asia, was false information for the first part of the year. Like they weren't handling it well, like the schools, all of the things so again, like whether or not we can, as a US system and the federal department, the FDA, like if they're actually going to give away the ability to do testing, they have to.
They did say, okay, let's try to get testing done. Let's open it up to lots of companies that are ready to go, and 70 companies are now testing this, are doing antibody testing. And now the question is, oh, hold it, it's not FDA approved. Well, you have to go through certain steps, and fortunately, we were able to get some data points early, and we had our testing ability was super limited, and we only had potentially a couple of PCR tests where they do the nasal swab. So we thought it was the best opportunity to get some amount of testing and then start doing this. And obviously, the Vibrant companies we've used before, and again, they meet some strict criterion, which we liked, and then we obviously looked at the study itself and with great sensitivities.
And this is the art of medicine, I think. So I think that a reminder in the pharmaceutical world, the whole, what is the Cialis and what is the other pill? Viagra. That was a heart medicine, right? And so I don't know if it's FDA approved, but it was off-label, and they figured out that it worked in magical ways in other ways. So I think that they're taking tests that have worked in other magical ways, and they're applying it to other things. Yeah.
Oh, there was a question about, is this testing for other...
That's a good analogy.
That was, yeah. There was a question about, is the antibody testing for current coronaviruses? And the question is, the answer is simply, likely not. We can say with a 97% certainty that it is not. The other thing I wanted to mention is if you do this study twice, meaning if you test positive for IgM once and we do the test again, if we get a second test that's positive, I can be with some certainty that the likelihood of testing for another coronavirus is even lower. So the more tests we do, the more comfortable I feel that we're telling you the right answer. Now with any test, there's always false positives and false negatives. But with repeat testing and with this Vibrant, we test 4 antibodies.
I'm going to tell you the question.
I'm sorry, 4 proteins. So we're testing 4 different proteins, and we're checking 3 different subtypes of those. So we're getting like 12 data points. With that data and then combining that with statistics, we're really dialing in on, okay, I feel really certain.
You got to dial back the doc talk. Stacy's asking what is IgG. So you got to pull it all the way back.
Okay. Let me show this. I have this.
Oh, I don't even know.
No, I want people to see this.
Okay.
Well, I have to see if it's...
I know. We're on a bit of a delay, so he's going to hold something up and see if it works. But Stacy, can you start talking about the IgG?
Okay, so there's 2. Well, I'm going to focus on two antibodies. There's IgM and there's IgG. IgM is the one that if you get exposed to something, it will start to increase, within 5 to 7 days. Let's see here.
Oh no, don't do that. Okay.
So IgM increases within the first 5 days. Really, nothing shows up. So if you get exposed to a virus, especially this one, first 5 days, you're not going to see any antibodies. After that...
It's so delayed.
I know.
That's okay. Keep talking.
So the Oh, man. The IgM... I'm confused. Can you hold this and I'll talk?
Yeah. Okay.
Oh, that's why I did that. Okay, so IgM is the first antibody to go up. It's usually delayed. So if you get exposed on day 1, day 5, we'll start seeing IgM. Then what happens is your body, it's an antibody, starts fighting off the virus. Then IgG starts up, and we don't know exactly when IgG starts up, but IgG is the antibody that gives your body a little memory that, oh, if I get exposed to this COVID again, could I be protected?
It's got smaller. Is that what you want to
That's good, yeah.
Okay.
So on this mark, the blue section is your symptoms. So you can see the first 5 days you're not going to really have symptoms. IgM is the yellow, and you can see it starts on day 3 to 5, and then by day 17, IgM is disappearing. And then IgG is the one that we're really interested in and that most doctors are interested in, because that could provide some evidence of immunity. We don't know if it's 1 month, 3 months, 6 months, or a year. Plus, you have to combine that with the virus potentially mutating, which would then maybe not make this as effective. But you can see IgM goes up initially, IgG goes up next. So if someone's purely IgG, we can say with some certainty that they're at least 20 days out from initial exposure. So this is where if we can do this with everybody, we can get some better data. And then if you're IgM positive, maybe you should limit your exposure to someone. If you're IgG positive only, then potentially you have some immunity. We're still not saying, give you carte blanche and go everywhere and expose yourself, but it gives us some data points.
So Michael said that he asked a question, there's different periods of incubation from 4 to 14 days. So is that what you're...
This is the best guess. This is the best guess.
So can you recap that just a little bit? The incubation 4 to 14 days? What
is
incubation?
Well, incubation is when the virus is replicating in your system, but you don't either have symptoms or you're not showing immunity to it. You're not developing that IgG. The day 5 is just the best guesstimate. Again, that can range in the individual and per person. And the more data we get, obviously, if we had this data, we have had 6 months of data, I could tell you with a little more certainty what's going on. But this is again our best guess, and this is the art of medicine.
And it's practicing medicine, so it's. I mean, I would say that you're probably listening to the news feeds. You're looking online. So it's like a daily, probably an hourly thing for you.
Yeah, I mean,
you're doing,
I'm not listening to Fox News, but I am listening to podcasts, doctor podcasts. Any other questions based on that?
Yeah. So can you try to summarize it like you're talking to a second grader a little bit?
With the antibody testing?
He tests these things out on me. He tries to explain how these things are happening. And if I go blank, he's like, okay, I got to try again. So
yeah. You mean the antibody testing?
Yeah.
Just there's 2 antibodies. One shows up in your blood soon. The other one shows up later. What most of the U.S. is focused on is that later, the IgG test. We just don't know with any certainty at the moment how long that potential immunity lasts. And that's going to just depend on a lot of things.
How long should someone quarantine if you had direct contact with someone that was positive? This is a great question because we have someone in our family that tested positive.
Yes. Well, the guidelines say 72 hours after acute symptoms or at least 7 days. There's other studies saying it should be 14 days because they have such a long incubation period. So generally speaking, when I talk to someone about this, we try to figure out when were they potentially exposed, because a lot of family members are dealing with this, meaning one family member has it, the other family member is exposed. We're trying to limit that. So it's 7 to 14 days, or at least 72 hours after symptoms have abated. Although I have trouble with that one just because a lot of patients have mild symptoms or they have no symptoms whatsoever.
Yeah. Well,
and this is why it's so successful. This is why the virus is the way it is. I mean, it's
right. I mean, so we have a grandma who has 0 symptoms. So we were totally shocked when she came back positive. So obviously we're living this along with you. One of the questions Pam asked was, she missed from the beginning. You should be able to go in and just pull the red taskbar and go back to the beginning and start it over. So I think that will work for you. Betty is asking that she's retired, normally participates in lots of activities in the community. Can you talk a little more about the three areas you said earlier, play, downtime, and structured activity. Like everyone, I feel like life has narrowed since the beginning. I like to think of ways not to make it feel so narrow. We're all with you, Betty. So play is really about being unstructured and being a kid again. So kids, like if, they'll take whatever they have. Like, again, like you look at a little boy that's playing, out in the yard, they'll grab a stick and make it a sword. It really is like at the time, like we've got a puzzle. I really forgot how much I really love puzzles, which Amazon delivers. And how much
you really like puzzles.
I really do. Like a little competitive in getting the puzzle pieces. And I am like the outside edge first person. Yeah. My daughter is the inside person. So it's very interesting. Some psychological experience going to my home. But so back to play, it's like finding things that you may have enjoyed in the past or things that you haven't ever done. So this is a great time to figure out, playing with your friends. If you wanted to do a dice game with your friends, that you can do that on Zoom, or you can do it on a platform where you're all on the phone together and you're able to play together. So those are things that you can still do socially to give it a little bit of an expansiveness. Again, we live in an incredible place here. So hopefully, Betty, you're going out and walking and getting time outside so that you've got that stuff. Downtime is really not thinking about COVID, not thinking about future worries.
Watching the news 8 hours a day is probably not helpful. Right.
And I think that, again, a lot of the clients that I've been talking to that have come back and said, I just need 30 minutes that are, in their retirement state, a lot of them, and they're looking at financial modeling and having fears there. And it's really too early. Obviously, this is an economic stress on us, and some of us are having those things. But in that, downtime is not the time to put those in. Set aside times where you can kind of look at, okay, here's the things that I need to be concerned about. And my approach is always think about what you have control over and what you don't have control over. So internal locus of control is like, what can I control? You can control, where you spend your time. You can control where your thoughts go. You can control those things. Then if you set time aside where you're like, okay, now I'm going to worry about the fundamental issues that I need to do. And then the last one, family time. Some people are kind of holed up by themselves. Some of us are holed up with maybe in situations with spouses that you really have had parallel lives a lot, or you've got kids and or grandparents and you're stressed with that kind of period of time because the families are all together. If that's the case, that family time is really about surrounding yourself socially with people that encourage you, make you feel better. So that's really the part that I think that PDF stands for. And I'll post a picture of it on Lifescape's page for people to take a look at for ideas for kids or for yourselves as well.
And talking about control, we don't control much. And I think this is what the virus has done. It showed you or put a light that we don't control much. There's not a lot we can control. We can control how we respond to things, but we can't control the virus. We can't control what Trump says. We can't control illness. All these things kind of happen randomly. And I think that's part of the reason why there's so much angst and anxiety and mood is it's putting it at the forefront. But that's where taking a break and resting and doing new hobbies, I think, is a great idea.
Yeah, one, my good friend Carol, who bounced in from Colorado, I miss you, talking about screen times, because obviously that's my thing, and I kind of geek out and talk about that a lot. I've recorded several that hopefully I'll put out soon on a new YouTube channel that I'm trying. But what I would say is that people are spending way more time behind screens, adults and kids alike. Right? So we're all kind of virtually trying to figure out how to keep our lives going. There is a difference between screen time that's academic, creative, and screen time that is wasteful, YouTube, pornography, gaming, things like that. So if it's building brains, that's better than breaking brains, is probably a good way to think about the screen time, the junk food of it. But also body mechanics.
back
pain, things like that. I'm like, oh, I was like, I had a really super stressful webinar this morning. And I was like, I think it's like the stress of getting prepared for that. And he's like, no, it's how you're sitting behind your computer all day. So,
and that's for kids too.
I know. He's got to pull that I'm the real doctor and like, tell me that I'm not sitting right. My form's not right. So, anyway, so the screen times, your eyes will get fatigued, your body, and it will fatigue your brain in ways that I think that people aren't taking into consideration too. So
our daughter's had headaches because she's on the screen. She's on the screen way more just because she has like 3 hours of homework on a computer.
Right.
Kind of crazy.
Yeah. So again, like the schools are doing their best to figure things out on their end. But I think that we've got to remind ourselves, build those in. So, put music in there, put walks in there, meditation, like things like that. Pull yourself away from the screens as much as you can.
Yes, I can post the diagram. That is actually from the Vibrant site who did all the studies. I thought it was an excellent graph. Again, you can't use that specifically like it's day 5 you have antibodies. They're, again, generalizing, and there's always margins of error of when things start and stop, and individuals are quite different. But that's a very good generalization of kind of the logic of IgG and IgM testing.
I think, are we only supposed to go a half hour? Does it just turn off? You guys want more information? You want us to keep talking about random stuff?
I think it was 45.
Oh, we get to keep going?
I think.
Okay.
Let's go in another 15 minutes.
Okay.
Should
we talk about post-pandemic thoughts? Or is there other questions? Do you have other questions?
Yeah, there was a couple that were asked earlier. Okay. Will we see it resurge in the fall, and how can we prepare? I definitely think it's going to resurge. The question then becomes do we have a vaccine at the time? Do we have new medications? This is the whole point of delaying that curve, is we're not having so many sick people, ill people that are overwhelming the hospital system. But it also buys us time to figure out, does this drug work? Does this drug work for prophylaxis? Does this medicine work when someone's super sick? Can we use this, in a person who's exposed multiple times? So yes, I think it's likely going to mutate. It's already mutated already. There's an L and an S. I looked this up. There's an L and an S.
Of course you did.
S already, and it likely will mutate again. Some of the studies I read is most of the time when these mutate, they mutate to less virulent, less deadly ones, although there's always a risk that it doesn't. But generally, it tends to mutate to something less severe.
And that's normal.
And that is a normal. It's already mutated multiple times. So
mutation sounds bad. So it's
okay. Yeah. It doesn't necessarily be bad in this case.
Okay.
But it has nothing else to do. It's in your body. It's replicating millions and millions of times in every person in the world, and that's what it's going to do. It's going to mutate. And then obviously in springtime, get your flu shots, get your pneumonia shots, get all your normal vaccines, get healthy. Nutrition, we have nutrition help at our place, get moving and exercising, all those things, keep your body resilient. Yeah. So that was another question.
So one of the things I'll talk about psychology, not a question, but it's something that I've been getting, is that this is similar to a trauma. It's not like a tornado touching down where everything comes in, the pieces all fall apart, and then we all can come back together and pick it up. I guess like 9/11 as a psychologist was one of those events where it's like the country is impacted by something, but it's short and it's over. This is a chronic trauma that is impacting people. So it's mostly more in probably my wheelhouse of like dealing with like chronic child abuse or, situations where relationships are dysfunctional and you're trying to figure out your way out of it and you don't really have answers, or there's reasons why you're stuck in it. So understanding that this global pandemic is something outside of our control and it's ongoing, that trauma response is a little bit different, because when it's an acute trauma or incident that happens, we can jump in and we can address it right then, and we can come together, we can center together, and we come towards one another. Whereas in this situation, we're isolated and we're all separated. And so we can't go see each other. We can't connect. We can't touch people. Like we can't do those things that really those are reassuring emotional needs of people. So I would say, really put that in the forefront, your emotional well-being, take your temperature, so to speak, of your, kind of how am I feeling today. One of my favorite things since we've been quarantined is my son, who woke up today at 11. He's 11 years old. He woke up this morning. He woke up at 8. Yeah. We put him to bed really much on time, I would say. And he woke up and he goes, I just woke up really happy. He goes, I don't know, super happy. And I was like, that is awesome, right?
That's sleep. Yeah.
That's sleep. It's sleep, and it's, and it's taking that temperature, and it's recognizing, he's the kid who at 4 would run in the room and he's like, can I just have some quiet time so I can get my thoughts together? So he definitely is kind of evolved and that emotional being. But again, think about that is this is an ongoing event. So it's going to take a little bit to unwind, and maybe don't think about the crisis right now of the what ifs, because I think that you need to reassess those timelines of 1 month, 3 months, 6 months from now, where are you going to be? And what is the financial outlook going to look like? And what is, where will we be health-wise and cure-wise and things like that? So
it's kind of like a cancer diagnosis too. A cancer diagnosis is it's a trauma, and then you have to deal with all these other questions of medications and treatments and radiation, and it's a chronic kind of thing. And what I usually tell people is just take one day at a time. Today, the CT scan was normal. Hey, take that and don't think about the CT scan you have to do in 3 months or 6 months or a year. Maybe it's the same thing.
Yeah.
Can pets be carriers? That is possible, although the risk is very low of that. This goes into what we call, risk stratification. What is a high risk event and what's a low risk event? So this virus, we think about two things. Well, I think about two things. Infectious dose, meaning how many of the virus you get when you first get sick. And that's why maybe why some physicians in the ICUs are getting sicker, is because their initial dose is much, much higher, meaning they're dealing with people with ventilation and this virus is aerosolized then. And then I also think about viral load, is how many viruses are in your nasopharynx or in your lungs. So given that, the risk of going to an NFL game is high risk. You get 50,000 people coming to one area, and obviously that's why that's gone. Is there a risk of going to the grocery store? Of course, there's a risk. The biggest risk is probably interacting with other people or talking to other people or sharing spit, and the more things you touch. The risk of having your pet have it is again one of these relatively lower risk things. So if I anyone asks me, is this possible? Of course it's possible, but is the risk high, medium, low, or minimal? So, and
people have different risk tolerances. Keep in mind.
Yes.
So, sometimes when you go out and you'll see people that are out and they're not wearing a mask, or they're doing things that you're like, why are you even outside? So there's kind of this, again, socially, it's don't make assumptions on those things. And you don't know the situations. It's hard to again, socially, I think that if we come together, it's a bit of an attitude. My Dr. Hansen wrote in again and asked about children, families, people feeling lost because they're not socially connected and they're not with people anymore. That is, again, the expectation is to go through those grieving stages, because it is a true loss when we can't have those connections. I am someone who tends to enjoy being with people more. Mm-hmm. Bill tends to be a little bit more.
I'm an introvert.
You're an introvert. So he tends to enjoy, if we're all here and we're at, the family house, I think you're pretty good.
Yeah.
Whereas it's I want to get out, have a conversation, see people. My son's a little bit more like me. So, getting in front of Zooms, getting in front of things. I've been doing virtual happy hours with friends that I haven't seen. I've been trying to get together and go on walks and put them in my ear, and we walk together at the same time. So we're doing something that's proactive and we're spending time with them. For our kids, I think it's equally
and distancing. You're not close to them, obviously.
No, I have them on my phone. Yeah. No, I'm talking. It looks like I'm talking to myself. I'm sure it looks like I'm totally crazy. But it was somebody went 6 feet away from me when I was walking on the trail, on the street. Yeah. Probably because I was anger talking, maybe when I was talking in my earbuds. But I think that for the kids, they don't understand what a pandemic is or what a virus is, or they don't understand some of that stuff. So I think that they're having that loss of friends. So how do you facilitate time together for them through these platforms and doing silly things together? So, giving little challenges to the kids, like, okay, we're going to all go on at 1:00 and let's see who can look the most like a Smurf. Go, for the little kids would be super fun.
Yeah.
And then hide if you have like paints or things like that, and then do little challenges with their peer group as a mom to do those things. Or you could go in and eat everybody, for the little kids, like the Play-Doh, and like create like, all right, who can make the animal, and then play, it's kind of like a Pictionary with that. Yeah. You do Pictionary with kids. Again, it's like get them in front of their
just games group. Between us. Just board games are fun.
Yeah.
Something.
I'm winning. Yeah. But yeah, it is fun. But again, I love you. But like what Dr. Hansen's saying is like some of us need social outside. And so particularly with their kids, they've been with school and their peers all the time.
It's funny. I talked to a patient of mine. I'm not going to divulge his name, but it was funny because I just emailed him and say, hey, how you doing? How are things? And he's an introvert, sort of like me. And he's like, I've been waiting for this for 20 years. It's like, some people get some rest. But I think it's important for an extrovert or someone like social to do some downtime too. Obviously,
Judy asked a question. Hi, Judy. About the spike in Arizona. I'll let you take that. When do you anticipate it? When are they talking? The
spike is supposed to be late April. So that's based on a lot of factors and math equations.
Is it the true spike, or does that just mean that we're testing it and we're going to find it?
No, that model that they're testing is based on mathematical models and hospitalization rates and prevalence rates. And there's so many presumptions in those data points that, and obviously with social distancing, I haven't seen any particularly the data points on what is how is social distancing reducing that number. Is it that the virus, maybe the case mortality rate is not 3%, it's more closer to 0.5 or 1%. But based on all those models, it looks like for Arizona, it's going to be late April, May 1st.
Okay.
Yeah.
Well, and Arizona's it's interesting. California just reopened their golf courses. And I said, in Arizona, we never shut them down. So legislators have different priorities, maybe, things like that. I don't know. But I do think that, how the spikes happen are how careful people are and how much we're actually listening.
Yeah. Right? And, like a golf course, you have 4 people. It's not like it's a congregation of 25 people as long as you're not going to the clubhouse. But that's going to be one of those things where it's scaled out and you can do certain things. And I think it's definitely going to change the social dynamics for at least a year. It could be longer.
Well, to your point, you said that the flu might not happen as much because you think that people aren't going to...
Yeah, well, I'm thinking the flu rates, depending on at least as long as it's not a very highly virulent one, might go down because we're all physical distancing from each other. Hopefully not social distancing.
Yeah. Yeah. And some people are enjoying it because they're not... I'm a hugger, so I'll have to fix that. Maybe.
I went... I can't remember where I went. I was introduced to somebody for the first time, and
this should be good.
And I just I reached out to grab just to see what they would do, and
like to test them.
It was a joke. It was because they laughed. Everybody laughed afterwards. Yeah. But I went right to shake their hand, and they actually they kind of did a half shake, and I was just joking about it. But that dynamic's definitely going to change.
Yeah. He's a top dog too. He's out there. Okay. Frank called us yin and yang. What else do you have on there?
Let's see.
He's got lots of nerdy stuff that he's scrolling through to see if he missed anything to tell you.
No, these are all questions. This is a good one. This is one for you. How do you react when someone tells you you've tested positive for COVID?
Yeah, that's really interesting. So I share a story. My daughter's birthday last Saturday, and Bill's parents' tests for the antibodies came back, and we're all, outside. We're on the outside patio. We've completely segregated ourselves because we think that we're vectors and pathogens of death for them. And I see him look at his phone. I have no idea, but I can tell he looks up at me and I've known you since I was like a kid. So he looks over at my son and he's like, "Hey, Colt, come sit with me." And our son was probably like 4 feet. away from Grandma and Grandpa, and I thought, oh gosh, somebody's positive. So Grandpa has already had it, and he has his antibodies, and Grandma currently COVID positive, no symptoms. And so my son reacted and was like, and burst into tears and said, I just don't want anybody to die. My daughter was extremely angry.
You're ruining my birthday.
Right, ruined her birthday. But I think hers is, her emotional reaction is that. I think that it's interesting. I think it goes back to, educating yourself on what it means to be COVID positive, and whether or not, if you're active, then you're shedding the disorder.
Possibly, depending on timing,
So you shouldn't see that person in person. But again, it should be, what can I would say as a psychologist, I would say, are you doing okay? Like, I'm checking in with Grandma daily. She's no symptoms still, but it's like, are you doing okay? How are you doing? So I think that the psychology of the person who's diagnosed is very different than the people who know it.
Yeah, and I've had some patients deal with this, and it's like there's a blame game. It's like I feel like if you did some testing, you're actually contributing to healing the country. Meaning you're going to self-isolate for a little longer. You're not going to spread it as much, and it's not like we know we're positive sometimes, and this virus looks like a lot of other viruses. It looks like sometimes like bronchitis, and looks like pneumonia. It looks like, so I say don't blame it first, and just be grateful that they were tested and took the time to share that data with you.
Right. And Lauren, you asked, are we offering testing for ones with symptoms, or is it anybody? Or
well, if you have symptoms, then potentially we'll do the PCR nasal swab test, which is a little more accurate for diagnosing someone with acute symptoms. The antibody testing sees if your body's reacting to it, and typically we're testing people that, oh my gosh, I was sick in February, I could swear I probably had COVID. So we're testing that more in retrospect, and it gives us a better idea of some people that have it don't even realize they do have it.
And what is the antibody test?
That's
like,
the
IG. What is
that's a blood test and finger prick test. They're trying to get it to a finger prick test only, which likely will happen soon. But right now we're doing both.
Oh, you still are? Okay.
Yeah. Okay.
Great questions.
Yeah. Oh, I as far as teaching our kids things, when our grandma was diagnosed with it, I can't remember what he said. I think it was when we were playing that game with we
were playing cornhole.
Mm-hmm. And I'm like, do you want to go play? I don't know. I said something like, do you want to go play that? And he's like, I don't want to take that risk. And it's like, oh, I'm teaching him something about risk. So anyway.
Yeah, this is the kid who wanted to go on a hike on the top of a mountain on a cliff.
Yeah.
So it's his risks at them. Any updates on the possibility of plasma?
That's the convalescent plasma. That's probably has the most data at the moment, as far as least potentially adverse reactions. Obviously, it's going to be saved for the cases where it's a last resort. I mean, so that's all I know about that right now.
It is really interesting. I had a patient who is a regular blood donor because they're that universal type, and so we don't know, like, are they testing for it? Are they screening for it, or like how they're doing it?
I think it's more of if this person's having a bad reaction and they're on the ventilator and they have an 80% risk of death, let's try anything. Let's try the hydrochloroquine. Let's try azithromycin. Let's try vitamin C. Let's try in those cases, you have to be, the risk at that point is the high risk of death, a low risk of adverse reactions because that person's about to die.
Yeah. Frank wrote into the comments for everybody to read how. So again, like Lifescape has always been on the cutting edge of like staying on top of everything. Dr. Wilder was part of that White House contingent, back in the day. We've been with Dr. Wilder since 2000, so 20 years. So I will tell you that if there's anybody more highly connected and staying on top of whether we could be on the vanguard bleeding edge of whatever is available, it is Lifescape. So
yeah, and we have time to investigate these things, and time keeps us on the edge, which is good. I'd rather be doing this, being proactive than just being reactive and waiting. I mean, we were told by Arizona State to not do any tests on anybody. I mean, when they were doing PCR testing, it's just like, it doesn't really make sense, and we have no data on what's the prevalence in Arizona. So I'm happy where we're at.
Yeah. Michael wrote in and said that he's had interesting reactions being positive and actually put the analogy of it being a scarlet A. I have been using that analogy as well. Actually, Grandpa Strohman said he was going to order a T-shirt that said, "I survived COVID." I said, too soon. Like, probably not. I do think, Michael, like, I think that it's interesting. Like, and to me, that's education. So that's the part that is, how do we communicate? How do we educate people? How do we share data? How do we make it's the psychology of understanding the part. So it's like, Michael, you have antibodies that makes you more protected than the people around you. So there might be some jealousy in some reactions. There might be some fear in some reactions. And it's really going to depend on the education of that person and being able to communicate it to them.
And it's hard for a patient to explain IgG antibodies to someone. I mean, and I think with the news the way it is now, I'm sure there's going to be much more newsworthy, appropriate talk about this, which will help everybody, I think, understand it.
Yeah. I mean, I think that one of the doctors that I talked to said that they're talking about doing like cards and, who already has the antibodies.
Wristbands.
So, and I was like, well, it feels like it's just about as good as an STD test, right? Like, I'm totally negative unless I went to the store an hour ago. Like, we don't know, like, if we're exposed or not. And if you have antibodies, what does that little card or wristband give you? Yeah. But I do think that has to do with the psychology of how people are doing that. And again, I think if you can acknowledge it when and if you have to say that, and just say, like, I again, totally appreciate it. Here's what's happening. Here's what my doctor has said about it. And here's what I know about it. And then you kind of have to let them figure it out on their terms and maybe catch up to where you are.
Well, and then that's where they might become angry. Just like the stages of acceptance, they might, what are the stages of Kubler-Ross?
Denial. Bargaining.
So you should expect any reaction from someone you tell that to, and it's not your fault. It's just that's how they're processing it.
Yeah. People are still staying on, and I don't like. Michael wants one. He wants a card or a wristband.
I think he wants a shirt.
Oh, you want a shirt? All right. I'll have to find out from Grandpa if he really.
My dad has a side job now. So.
Yeah, exactly.
All right. I think that's.
Any other final questions from our loyal viewers? And again, like, most of the people are Lifescape folks. You have access to email your docs, ask questions. If you're a concierge patient, you have questions for me. You can reach out. You can go, I guess, to my website. I don't really have drlisastrohman.com. There's a portal in there to submit things if there's psychology questions that I can ask you with, or if you want to set up like a 30-minute. I'm happy to answer direct questions. Diana. Okay.
So am I, actually.
Yeah. So Diana.
I'd prefer to be IgG positive.
Yeah. She says there's some jealousy. She has some jealousy when she hears people have positive results after getting a negative test results. And she was surprised at how much it made her feel. I think that's, that the interesting thing is Bill's dad, nobody knows him. Probably a good thing. No, I'm kidding. I love Grandpa. But he has pulmonary disorder. He has like emphysema, COPD,
he's a high risk
heart
patient.
attack. Yeah, drinks at night.
High risk patient.
High risk patient. Was very, very sick in February for probably 6 weeks. I knew he was really sick because he didn't have any wine every night.
Yeah.
So he was very sick. And came through, and now he has antibodies. So yes, and he kept saying, "I just want to get it, so I get it over with."
And then he had it.
Yeah.
And luckily survived.
So now, in the hindsight, it's like, careful what you wish for.
Yeah, really. Yeah.
Because thankfully he came through, and it could have been worse.
Could have been significantly worse.
So, but I'm with you. I'd like to get it over with, have the antibodies, and feel a little bit safer. But we don't know. I mean, at best, our guess is probably a year, right? That we are protected.
We don't know. I mean, there is something called herd immunity. So if 60 to 70% of the people in the population have been exposed and have some antibody, that the likelihood of that population getting the virus is really low. So it's called herd immunity. So
like in our population in Arizona,
or like
US,
the US.
Oh, okay.
I mean, just like measles, you see the spread of cases. There is something called herd immunity, which gives the herd, the population, some protection So who knows when that happens? But we'll have more data points on prevalence when we start doing these antibody testing and figure out, okay, 20% of people have been exposed to it, or 50% of people have been exposed to it.
Yeah. And then what about Susan's read some stories about who've tested positive 6 weeks or further since the initial positive test. Any explanation of risks of still being able to contaminate others?
Well, I've read some of those studies, and there is possibility that, well, there could be two questions here. One is they've been retested, and I don't know what test they've been retested with. I think the initial studies were on PCR testing, which is a test of the nasal swab. So potentially they might have had a false negative test, then they repeated the test and it became positive, and then people were like, oh, they reinfected themselves. Well, it's probably more likely that they had a potentially false negative test and then a true positive.
Well, she's saying that they've had positive tests and then positive tests again 6 weeks later.
Well, it depends on what test it is. I mean, if it's a PCR test, that would be very atypical. If it's IgG testing, then they're going to be positive, hopefully, for a long time. That's what gives you or pretends a little bit of protection, but which we can't qualify at the moment of quantify.
Our good friend Kristen asked, how long does it really live on surfaces? Does it really live on surfaces?
Well, really, okay.
It's okay to say you don't actually know.
Well, I mean, it goes back to my first part where I told you what's the relative risk. Again, the relative risk of a virus being on cardboard versus the risk of communicating with someone at close distance. That close distance is probably higher risk than a cardboard. But yes, it can exist, for anywhere from 24 hours to 2 to 3 days. But again, it degrades. Packages. Yeah, it degrades. So
are we wiping down things from the grocery store?
You can, again, if you're like someone that has COPD and asthma and had a heart attack and all these things, I would take every risk out of it as much as possible, because your risk of having a bad event with this is pretty high. 8%, 10%.
But we talked about that cruise ship. Remember, they said they found surface contaminants 17 days later.
But
is there more recent data that we should know about?
But is that a virulent dose? Is that a infectious dose? That's the question. Is that enough to make you sick? That's the question. We don't know that.
Okay.
But again, if you're a high-risk patient, you take all the precautions in the world. If you're a low-risk patient, I'm still taking precautions, but maybe I'm not wiping down everything every second. It's all relative. It's all relative risk.
Take out. I mean, we had that wonderful meal at Dominic's.
We a lot of people touched that, so we had a little section of our kitchen. We took it out. I was the dirty person. I dumped it in, and I threw everything away, and I washed my hands.
Yeah.
So
So just being really careful in that. The most important question, I think. Well, when can we go get our hair and our nails done again?
I don't know. Talk to my hair cutter guy.
Okay. All right. I think that's. I know. I feel like we're going way too long.
That's it.
Nobody wants to see us anymore.
Okay.
I had a lot of fun.
Yeah, it was fun.
Yeah.
Yeah.
You like it?
Yeah, it was good.
Okay. Only send positive comments.
Yeah.
No, just kidding.
All right, we're gonna sign off.
All right.
Let me see.
Bye, everyone. Oh, we'll see. We may not be signing off right now. Okay.